There's about 500,000 people who die of malaria every year, but 90% of them are from sub-Saharan Africa, and of those, about 80% of these deaths affect children under 5. We're basically visiting and touring different health clinics all around in rural Zambia. What I really have focused on as part of this research, which are challenges on the supply. So the supply chains of how you get the effective medicines that are now available to treat malaria in most cases, and manage the supply of these medicines so that they are available. Too frequent experience is one of a father or mother basically bringing their sick child with a malaria fever to a clinic, only to find that the effective medicines that they do need to treat their child at that point is not available. I was contacted by a team working with the World Bank on a really large supply chain pilot project that was to be organized in Zambia. Because of this connection with the supply chain modeling work I had done in the private sector with companies like Zara and Amazon and Dell. So in order to carry out the research, we quickly realized that we needed a lot of data. And getting data in Zambia is very challenging because there's all sorts of infrastructure challenges, not even computer, networks, telephone, but also electricity and even road access. First thing we started to look at then was the inventory level in the central warehouse, which was supplying all of those remote locations. There was a lot of stockouts, that is, times when the availability of a drug is problematic. But at the same time, the central warehouse in Zambia, which was supplying all these locations, had tons of stock. There was an underestimation of the peak of demand that was created by the rainy season in Zambia, which entails, among other things, an increase of the population of mosquitoes and therefore increase in incidence of malaria cases. What we identified is an opportunity linked to current information and communication technology and leveraging the availability of mobile devices and wireless networks, even in very remote parts of rural Africa, for the purpose of really digitizing the supply chain. By implementing and simulating the type of forecasting method and inventory management method that the work is about, we measured increases of that service level up until 98%. But this work has led to challenges in the development of different systems and different ways of managing inventory that the Ministry of Health of Zambia and MSL, the organization that manages the distribution of public medicines in that country, have taken on board. I have found that the London Business School is a great environment for doing the kind of work that I'm interested in. Critical has been the quality of the PhD students and their level of interest in getting on board with those projects that I've been doing to try and model and research the delivery of health in low-income countries.